It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Thanks for joining us, folks. I'm Sam Lesante. Remember, you're going to watch us on high definition now, 513. Today, folks, we're going to talk about what we do every day. Some of us do it every day. We talk. You know, it's like speech. And it's going to be an interesting show because we're going to talk about speech therapy. I know I need a lot of that, but our guest today is Catherine Gallagher. She is the occupational therapist at the Director of Outpatient Rehabilitation and Support Services at the Lehigh Valley Hospital, the Hazleton and the Health Wellness Center at Hazleton, and Jennifer Hoats, who is the speech language pathologist. Now, girls, thanks for coming on the show.
Thank you for having us.
Now, you're not going to correct me now. I have on my speech, I say this, say that, say this, because when I'm at home, and my wife's making me pasta, I'll say, is that al dente? And she'll say, it's not al dente, it's al dente, okay? And, you know, I get these little, because I always screw up the words. So, but it's good to know how to speak properly, particularly if you have a talk show. Catherine, how you been?
I'm good.
So this is your 30th time on the Sam Lesante Show, or what?
Numerous times.
Numerous times. Always nice to have you on
It's always nice to be here.
And you do such a great job up there. The entire team does a fabulous job. I was telling you a story about when we did a show up there before, a while back. I was on location, and one of the viewers saw it and had suffered a stroke, etc., and then went up and they couldn't have been happier what the results were. I'm sure many more came up after that. But Catherine, specifically describe, what do you do?
Well, at the Wellness Center, we'll be there 10 years in 2017. Can you believe it's been that long?
I can't.
Yep, and the building's still just as beautiful as ever. I'm in charge of outpatient therapy. Part of outpatient therapy is physical therapy. Within physical therapy, we have a beautiful aquatic pool. So we have aquatics. We have therapists that specialize in a number of different areas, including balance and vestibular therapy. We have 2 therapists that are certified in Big and Loud, which treats Parkinson's and neurologic disorders. We also treat occupational therapy. So we have occupational therapists that treat hands, pelvic floor, lymphedema, a whole vast variety of things. We also do a lot of industrial rehab for our client companies in the area. And on top of that, we have speech therapy. We do adult and pediatrics.
In your outpatient support service and rehabilitation, these are all prescribed. I mean, these are the doctors prescribe them to do rehabilitation, correct?
Yes.
Now, I know that you have things that Lehigh Valley has always the latest in new technology. The pool, for example. I mean, that's a very advantageous for people who cannot function properly.
Pool's wonderful, especially for people who have a lot of pain and can't get through a lot of land-based therapy because the buoyancy of the water decreases their weight and decreases their pain level. So they're able to exercise more in the pool and move more in the pool. Our pool's about 96 degrees, so it's warm for their joints and they can move a lot easier.
Now, there are people out there that would like to use that. Okay, do they have to go to their family doctors, or can they just join up there and then can they use the facility?
Well, if they're going to use the pool and they're part of our fitness center, they have to set specialized training sessions, and the therapist and their trainer can go into the pool with them.
Okay, so in other words, you just can't go up there and be part of the regimen. You have to have prescribed.
You can be part of our gym community, our fitness community. We do have exercise physiologists and trainers that will train people, and we have community gym members. And those people, if you want to use the pool, you have to have someone with you.
So in a rehab, when someone has either had surgery or needs a specific rehab, you follow the doctor's instructions, and then there's a process of how you do that, right?
That's one of the nicest things about our wellness centers. We have a very close relationship with our physicians. A number of them are right in our same building. We also have an electronic medical record, so the doctor can see all of our notes and see what's transpiring with their patient when they come in for their office visits. But yeah, the doctors will refer to us, typically with most, like a joint replacement or different diagnoses. There's a specific protocol that we follow, and the doctor sometimes sends that along. Otherwise, the therapist will do an evaluation with the patient, put a treatment plan together, and then send that treatment plan to the doctor for his approval. He'll sign off on it.
Now, they're monitored, correct? So when someone comes in and they have to go through a regimental procedure, is the doctor aware of how that person did, or do you do reports, or how does that work?
Absolutely. Well, when you come in for therapy, you're always with a therapist or one of our therapy assistants. And then before you see the doctor, the therapist will do a progress report on you, or a reevaluation, so to speak. And we'll send that reevaluation over to the doctor's office prior to your doctor appointment. So when you arrive, the doctor is aware of how you're doing in therapy.
And there's always, there's always doctors around. I mean, something may happen if a person isn't feeling well, or something happens during the rehabilitation. You're always protected. I mean, there's always people there, correct?
Always.
Yeah.
Always. Our building is full of doctors and nurses and we work as a team. So people will come to help, but hopefully that doesn't happen.
No, I'm just saying, especially if you just get from surgery and you're weak and
Absolutely.
You're starting to get back into it. I mean, so it,
Our orthopedic surgeons are directly across the hall from us. Our physiatrist, who is also our medical director of our outpatient rehab, he is across the hall from us. Our occupational medicine physicians are across the hall from us. And we have imaging and cardiac doctors downstairs.
Yeah, you could hold the gamut. Like I said, the team itself that you have, it's a team, effort, and it works extremely well. Moving into your area, Jen, you're a speech language pathologist.
Yes.
Now, what is that?
Most people kind of think of us as, the exposure that they've had. Usually you think in elementary school, the kids who didn't quite say their sounds the right way, they went to speech therapy. But speech therapy actually entails a lot more than that. We also address language. We address cognitive problems such as memory, problem solving, attention, being able to focus and concentrate. We also address swallowing, and in some individuals, we kind of address all of those at the same time.
So here again, I had mentioned when we were up there, the person who had a stroke having difficult time speaking, okay? And then he came up to the Wellness Center and was able to go through the different procedures or whatever they do. Now you said there's different areas, right?
Yes.
Okay. So give me those again.
We work on the speech.
Yeah.
The language.
All right, so if staying with speech, if a person is, your director here, Sam, used to say "bogo," he used to sound like a New Yorker, okay?
Yes.
And so I think we went to St. Joe's at the time or whatever, and just to say how the proper words, right? Does some of that come from, your environment surrounding you, or is it then you have to straighten that out, right?
Well, a lot of times, from the speech perspective, especially with children, a lot of times it is an accent, and that's something that, it's not considered a disorder. It's not something that they would come to speech for. But a lot of times, for whatever reason, children go through a phase where mispronouncing words is typical, but they should outgrow that. You've all heard children say, tat for cat. Things like that are developmental and appropriate in a small child, but as they start to grow, for whatever reason, some children don't outgrow those ways of speaking. So, parents will bring them to speech therapy. We address the individual sounds so that they can speak more clearly and be understood by others.
So that's interesting, because when does a parent know? I'm staying with the children. When does a parent know? Because he talks that way, it's funny, etc. But when does a parent know to say, wait, maybe we should call Jennifer Hoats and say, Jennifer, I'd like to bring my child in for appraisal or whatever you do, When should they be doing that?
Typically, either the parents are concerned because they realize that their child is not speaking as well or as clearly as other children that are close in age, or the physician will examine the child at their annual visit and have a concern. I really am not understanding what this child is saying, and I should be at this age. So usually it's an effort either on the parent's part to tell the pediatrician, I don't think that my child is speaking as clearly as they should, or sometimes the pediatrician will comment to the parent. Same thing for language development. If a child is not using as many words as they should, or is using very short sentences when they're an older child and should be able to put together a long sentence. Usually the parents are pretty aware. They're with their kid all the time. They're taking their child to preschool and they're saying, little Johnny or little Jill isn't talking as well as the other kids in her class. Usually the parents express a concern to the doctor.
Okay, so looking at you, Jennifer, you look like you're, a teenage girl, okay?
If only.
Yeah. But I mean, so when you're looking at experience, okay, and what is your background?
My background and my expertise is in the area of brain injury. I'm a certified brain injury specialist, and I have about 10 years in the field working with brain injury and in the field of pediatrics as well. Our staff as a whole is actually a very experienced staff. We have another full-time speech therapist who he just finished up his doctoral degree in the last couple of years, did his research in the area of autism, so he sees a lot of our autistic patients. He's also certified in a procedure called Vital Stim, which is using, a lot of people are familiar with it more from a physical therapy standpoint. When you go in and they would put the pads and the electrodes on your arm to stimulate the muscles, we can do that with the muscles used for swallowing to strengthen the muscles and kind of bring back some function, typically after a stroke or a head injury. And then we have another two therapists who also have multiple years of experience between our outpatient and the hospital. So we have a good experienced staff.
And what do you specifically specialize in?
I specialize in the area of brain injury.
And so that's either surgery, and after that?
Right. What constitutes a brain injury is any time something after birth has happened to the brain. That could be, a person who has been engaged in abusing alcohol or drugs and they've had a head injury from that. That could be from a stroke. That could be from having a blow to the head, which typically we see from a fall, a car accident. Sometimes we'll see gunshot victims who, whether it be intentional or accidental, they've had a head injury from that. But anytime the brain is damaged for whatever reason after the time of birth.
And what has been the success rate? I mean, I know it has to be a slow process, because what has been your success rate?
It all depends on the severity of the injury, the type of the injury, and a lot of family factors too. If the person has a good support system from their family, they tend to do a lot better. If the person is very motivated, they tend to do a lot better. And then of course there's varying severities of injury. A lot of times at the Wellness Center, we will see people who have a diagnosis of post-concussion syndrome. In that case, most people think, like, I hit my head, it was only a concussion, it's not a big deal. But a concussion really is a mild traumatic brain injury. Some people bounce back very quickly from that, but the NFL actually is bringing out a lot of new information about concussion. If you hit your head multiple times, those concussions, you don't bounce back as quickly, time after time after time. Also, the age of the person plays a big impact in how quickly they recover. People that are kind of in that in-between age tend to have more of a recovery after head injury. The very young tend to have a slower recovery, and the very old tend to have a slower recovery. But we've had pretty good success with recovery of cognitive skills with the head injuries that we've had come into the Wellness Center.
You would think that the internal thing would be medical, okay, right, or pills or surgery, etc. It's interesting how with what do you do in therapy of you're not touching, you're not going inside the
right.
I mean, so is it like how does that process work?
And that's typically the first question that every patient asks is, well, I had a head injury, how are you going to fix this? Yeah. The way I like to describe it to patients is it's in terms of something that they're very familiar with. If you have a weak muscle and you go to the gym, you could do this 1,000 times and that muscle's never going to get stronger. If If you put a weight in your hand, if you try and lift a 500-pound weight and you haven't been exercising, you're never going to be able to do it. So what you do to build muscle is you go in and you start with a small weight and you do your workout, and that muscle gets a little stronger, it gets a little easier, you get a heavier weight and you work your way up. So what we do in cognitive therapy is we give the person tasks that are going to challenge the specific area of thinking that they're having problems with. So maybe right now they're able to remember up to 3 items for, a very short period of time. Well, I'm not going to ask them to remember 20 things for half an hour. We start out and we challenge the brain to work it a little bit harder, and that helps the brain to reform some of those pathways that have been damaged. It helps good portions of the brain to take over the function of the damaged portion of the brain. So that's one aspect that we do, but then at the same time, we're also teaching the person strategies to compensate for the lost function. So, if you can't remember for more than a couple of minutes, you're not going to remember a doctor's appointment that you have next week. You're not going to remember your therapy visit for 2 days from now. So, we give patients strategies to use, writing things down, using, rehearsal strategies, kind of the things that you do when you're in school and you're trying to remember information for a test. We teach them, maybe what they used back then. You need to use that again.
And has that been successful for you?
Absolutely.
Well, why can't you do it with dementia or Alzheimer's?
The difference being in traumatic brain injury or a stroke, you have a one-time injury to the brain. So from that point, the damage is done and it's not expanding. Whereas with an Alzheimer's or a dementia, we do treat those populations, but we're looking at that more from a standpoint of these are some things to compensate for the loss, not let's fix the brain, because that's a progressive disorder. So where you have a damaged area in the brain with a TBI or a stroke, it's staying that size. Whereas in dementia or Alzheimer's, that damage is expanding. So with the progressive diseases, we will work with those people on some of those cognitive skills like the memory, the reasoning, but we're working on it from a different aspect, more from compensating for that loss and teaching them strategies to how to still be able to function fairly independently with those losses.
Folks, I'm talking with Jennifer Hoats, right? Speech language pathologist at the Health and Wellness Center, and also Catherine Gallagher, who is the director of outpatient rehabilitation support services. I'm learning a lot here today. Okay, we come back. Are there any things that we should be doing to make our brain healthy? What do we do in terms of exercising our brain? We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Today we're talking about speech therapy. We have Catherine Gallagher, who is the occupational therapist, director of outpatient and rehabilitation support services. Oh, I say it all at one time. The Hazleton and the Health and Wellness Center at Hazleton. We also have Jennifer Hoats, who is a speech language pathologist. Remember 513, folks, a higher definition. My email is sam@ssptv.com, and also you can watch all of our shows on our website at ssptv.com. Catherine, if someone wants to get an appointment, at the Health and Wellness Center, what do they do?
Well, they should see their family physician, get a prescription for therapy. They can call and schedule an appointment with our scheduling department, and that number is 570-501-6600. And anyone there will take care of them.
Okay, so if I want to come and just do work out, or if I want to join, do I need to go and see my...
No. You can come into the fitness center and talk to one of our exercise physiologists. Their direct number is 501-6750. They will set them up with an evaluation. Okay. They will send a letter to their physician just to let them know that they're joining an exercise program and making sure that that's okay with their family doctor. Okay,
but if I feel my knees are not working the way they should be, I'm not as mobile as I should be, and I may need some therapy, okay? That's where you should call your family doctor and say,
Absolutely.
Look, now, do they need to go? Well, that's up to the doctor. Doc, I'm having trouble with my knees. I just saw the show with Sam and the girls from the Wellness Center. I'd like to go up for therapy. You know, could you give me a prescription? Or he'll either say, well, come in, let me check it. Then it's
Absolutely.
up he or she to decide that. Is that how that works?
That's exactly right.
And then, of course, it's always best to do that because then you know specifically from the doctor what
Course of treatment he would like.
course of treatment he would like, okay? And that number is 501-6600. If we've got additional information, folks, if you want more information as to what you should do to call the doctor, you know, please do that. When you're talking about speech therapy, okay, and you know, now the areas you cover again, just in case people are going through the channels, what are some of the areas that you cover?
We cover the entire age span, and we will address issues with speech, the way that the sounds are being produced, language, how, you know, whether the person is having trouble finding words to use, or if it's a child and they're not developing language properly. We also do rehab for stroke, brain injury, post-concussion, and swallowing. I think I got them all.
So each one of them, you know, for people that can't swallow properly,
Correct.
And I think I spoke to someone up there a while back on the proper way you swallow. That's again is a therapy, correct?
Yes, and a lot of times we will see people who are having difficulty swallowing after a head injury or after a stroke. You know, they maybe have to have an altered diet, or you know, things are not going down well, they're coughing, they're choking. That's definitely something, you know, if somebody is having those kinds of difficulties, definitely something they want to address with their family doctor. And it's probably something that they're going to refer to speech for.
So what kind of brain health therapy could you give people? Is it reading? Is it memory? Is it, you know, using their brain? However, what do you recommend?
As far as cognition goes, it's one of those things where you use it or you lose it. So, you know, a lot of times... A lot of times we see people after they retire start to go downhill very fast. You know, everybody has a family member that is in that situation. Yeah. But the way to prevent those kinds of declines, a great thing to do is just to do things that keep your brain active. You know, a lot of people enjoy doing the crossword puzzles in the paper, those number Sudokus, you know, anything where you're challenging your brain to do things that are new. You know, even things as simple as rearranging the furniture in your house is a great way to keep your brain active and working.
Now, what homework do you give your people when they leave?
We give them plenty of homework.
Yeah.
A lot of times, especially with the cognitive therapy, we will give them, you know, ways to use those strategies at home, and we'll check up on them next week. Okay, so did you remember to go to that doctor's appointment? What strategies did you use? Were you trying to implement those things at home? With a lot of our stroke patients who have language problems, you know, we will give them things to work on those word finding skills, to work on putting those sentences together. We'll hand them a stack of the cards or the papers or whatever that we're using in therapy and say, here, try these at home.
So let me ask you, are there key things that may spark a memory? For example, if you're in the home and you need to do something, if you're looking to see the color red or black, or you know, a picture, or you know, or whatever, things that, okay, if you know you're gonna have a problem, look at this, okay, and could spur something. Is there things like that?
You know, for basic age-related memory problems, a lot of strategies that work good are to just pair things up when you're trying to remember something new. Pair it up with something that you already know, or associate it with things, because our brains like to file information very neat and orderly, just like a filing cabinet. Typically what we're addressing is when there's an insult to the brain, whether that be from a head injury or from a stroke. It's almost like somebody came in and tipped the filing cabinet over. The information is there, but it's not easy to get to anymore.
So you saw my office, huh? Don't come into my office, or I'll be coming up there for treatment. But I guess, you know, sometimes in an office, you know exactly where everything is at. You know,
right. Yeah. That's kind of what happens in a head injury, is the information is all still there, but it's not neat and orderly like it was before. We're trying to teach people how to retrieve that information.
And once again, Catherine, what do you do up there? What's what are the services you offer, in case, again, just to review?
In outpatient therapy, we offer physical therapy. Part of physical therapy, we have aquatics, balance and vestibular, joint replacement, neuro. We have therapists that are certified in a Big and Loud program, which treats Parkinson's disease. We have occupational therapy, which treats hands, pelvic floor, lymphedema, industrial, the list goes on, and speech therapy. We do adult and pediatrics for both, for OT, PT, and speech.
Well, once again, folks, just to get additional information, if you want to find out whether you should call your family physician or whatever, the number is 570-501-6600. And they'll give you direction from that area. Catherine and Jen, thanks for coming on the show.
Thank you.
Thanks for
Keep up
having
the good work up there. They got great people up there.
Thank you.
Folks, once again, you want to see all of our health shows, you go to their Lehigh Valley Health Network, their website, or go to my website, ssptv.com. All of our medical shows are there, and it'll give you a lot of good information. We'll see you next time.